The year was 1854. London's Soho neighborhood was not nearly the bustling cultural haven it is today. Instead, the streets were cramped, packed with people, and people just threw trash, human waste, and other bits of detritus into the streets for it to collect and run off with the rainwater. These conditions led to a serious outbreak of a deadly disease called cholera, a disease which causes diarrhea, dehydration, and in most untreated cases, death. This outbreak was serious, but at the time, germ theory had not been invented or discovered. Instead, doctors believed that the outbreak was caused by the concept of miasma, or bad air. This theory of miasma posited that bad air created through decomposition of waste and rotten materials could lead to the spread of disease throughout the population. Although wrong, this theory was the best that top physicians had at the time, and the closest thing that they had to understanding the origin of disease. Although that was the cultural norm and the scientific standard at the time, some scientists didn't think that this theory of miasma was sufficient, and they sought to find new answers. This is where physician John Snow stepped in. Through collecting anecdotal evidence from residents and mapping reported outbreaks, Snow was able to discover patterns and create his own hypothesis of what was happening. Through his investigative efforts, Snow was able to discover that all of the people who had contracted cholera had all retrieved water from the same pump. Stumbling upon this revelation, Snow convinced the local council to replace the local Broad Street water pump. After replacing the pump, the cases of cholera in the Soho neighborhood decreased rapidly, and thus the modern epidemiology movement was born, thus giving John Snow the moniker of the father of modern public health. Although John Snow's handling of the cholera outbreak is considered the birth of modern public health has actually been practiced to varying degrees of success since humans started contracting diseases. And since the advent of public health initiatives, there has always been some form of backlash and obstinance from the general public. However, in recent years, this backlash has been magnified and has become outright defiance, and then public violence towards public health officials and public health practitioners. Since the pandemic, the public has been extremely reactive to public health initiatives and have been organizing to be anti-science, anti-evidence, and anti-public health. Navigating these changes has been difficult for public health professionals across the country, especially with the upcoming changes to the presidential administration and the administration's plans for the public health infrastructure. There will potentially be various impacts across the board for different public health organizations. So now more than ever, it is really important to talk about public health and how it fits into this new age. Now you may be thinking, why am I, of all people, qualified to talk about public health? Well, for one, I actually work and receive my education in the field of public health. So the topic of public health and what has happened to it in its past and what will continue to happen to it in the future is extremely relevant to me. And two, as a person who exists in community with others, I think it is my obligation to care deeply about the state of public health and the public health infrastructure in this country. It is my belief that my health and well-being is intrinsically tied to the health and well-being of others. And I think that this is where the viewpoints about public health in the United States vary widely, because the main tenet of public health is to care about the health and well-being of people outside of just yourself and your immediate circles. I mean, it's literally in the name, public health, but public health is about creating initiatives, policies, and programs to sustain and maintain the health of the general public. This collective approach to health is in direct opposition to how many Americans think and view their health care. Individualism is a powerful driver in the American mentality and can lead to strong anti-public health sentiments, which were played out in the most recent and topical example of the COVID-19 pandemic. But before getting into the backlash to COVID-19 and what that means for public health in America moving forward, let's define public health, because there is so much more to public health than what most people think of. At its core, public health is the science of protecting and improving the health of people in their communities. The goal of public health is to eliminate health disparities by enacting evidence-based solutions. This ultimate goal can be achieved in numerous different ways through public health programming, public health education, research and development, and recommending public health policies. Normally, when people think of public health, they usually envision the epidemiologists working hard to detect, research, and prevent infectious diseases, such as COVID. But there is so much more to the public health field. I mean, public health encapsulates a number of different fields and subspecialties: restaurant inspectors, community health workers, nutritionists, social workers, community planners, occupational health and safety workers, biostatisticians, and first responders like doctors can all be included within the purview of public health. In addition to public health covering a number of different professions, it also covers a wide breadth of content. Honestly, there's way too many to cover, but I'll just mention a few here, including the major public health fields of health equity, which encompasses topics like tobacco cessation, immunizations, maternal and child health, and others, communicable and infectious disease preventions, things like COVID, common colds, flus, etc., health promotion and health behavior, which includes fields like overdose injury and violence prevention, nutrition, oral health, physical activity, and so on. And also additionally, environmental health, which has a number of different environmental-based public health concerns and subject areas. These are just a few of the important fields studied within public health that are so integral to the field of public health and also helping and promoting public health. And as you can probably tell, public health touches so many varied fields, and it is so much more than the vaccinations in COVID-19 that it was linked to most recently. However, the public health profession is so often overlooked and under-recognized. So many hard-working public health professionals working across the countries in local health departments, community-based organizations, and hospitals across local, state, and federal levels work to help protect the health and well-being of the general public. But these hard-working individuals generally work without recognition, changing lives and helping establish equitable health access to individuals from the shadows. Although public health professionals during the COVID-19 pandemic were initially cheered for and regarded positively, as time went on, they went on to be mocked, scorned, and reviled. People misdirected their anger at the circumstances surrounding COVID towards the only people trying to help them. However, COVID-19 is not the first time that public health professionals have faced backlash for just trying to do their jobs, and it certainly won't be the last. Over the years, public health has been a beacon for public and political backlash. Honestly, I was gonna give discrete examples of this political and social backlash, but there are just so many examples to choose from. It's actually kind of disheartening. I mean, I knew that there was going to be a lot to go off of and a lot of content, but it's just kind of staggering how much hate and hatred has been directed towards public health as a profession. I mean, every discipline within public health seems to spark some sort of political and social upheaval. Going down the list of the most notable public health achievements, it's rare for those advancements not to be protested. One notable example is vaccine development, which is one of the most influential public health advancements that has saved millions and millions of lives, but it's also one of the most reviled advancements that public health has ever seen. Even before people claimed the fictitious link between vaccines and autism, vaccines were a point of concern because people misunderstood the mechanisms, claiming falsely that they led to more infectious diseases because they had live viruses within them, or that they were methods of governmental control. Additionally, some people still refuse vaccines like the HPV vaccine, which is scientifically proven to reduce rates of cervical cancer because they are morally opposed to the vaccination and what it supports in their mind. And that is one, albeit most famous example of public health work that is completely scorned and reviled by certain segments of the population it's intending to help. Others include tobacco control. Although tobacco control has reduced significantly the rates of tobacco-related morbidity and mortality, tobacco control was opposed vehemently because it interfered with people's abilities to smoke where they wanted. Motor vehicle safety, like the seatbelt laws, are in a similar vein. People really opposed that law to begin with, and there are still places in the United States, looking at you, New Hampshire, where seatbelt laws aren't enacted. Family planning services, HIV prevention, occupational safety standards, environmental protections, all at one point or are currently going through strong opposition. And this is not an exhaustive list. Like I mentioned, there are so many more examples of public health advancements that are directly opposed by the general public, disregarding evidence-based theories and practice that proves that it might be beneficial for people's health. Based on this, public health, especially in the United States, has always and will always be political. COVID-19 was just a very powerful example of this politically charged atmosphere related to public health. But in general, people have opposed public health initiatives for forever. Now, you may be asking why? Why is there so much backlash to something that's for the greater good? Well, there are many resources that posit their own ideas, and there's researchers who are looking into these ideas as well, but I would just like to throw my own hat into the ring and give my own theory. Personally, I think it's a little bit of the cultural individualism of the United States, the fear of changing the status quo, and a little sprinkle of anti-intellectualism just to liven things up. This combination leads to a strong desire desire to preserve what are considered personal liberties and reject public health initiatives that seem to infringe upon those personal liberties. And this is what makes public health such a difficult dance. In an effort to be anti-paternalistic, especially when it comes to health behaviors, public health professionals sometimes have a build it and they will come philosophy when it comes to public health initiatives and building up public health infrastructure, taking the stance that just by implementing certain public health programs, this will help steer people into taking up certain behaviors that we hope will lead to healthier outcomes. However, sometimes this anti-paternalism isn't the best method, and the most effective method sometimes, unfortunately, is a paternalistic method. For instance, taking a more top-down, more heavy-handed approach to public health through different mandates and certain laws. The seatbelt laws and ordinances being a good example of that kind of method of public health. So, in general, public health is always polarizing, especially in America. And public health professionals are constantly trying to respond accordingly while also still promoting equitable public health outcomes. But more recently, the backlash to public health has almost been overwhelming, leading to a general hate campaign against everything and anything related to public health. So I won't go into too much depth about the correlation between COVID-19 pandemic and the anti-public health movement, because most of us were there and we lived through it. It wasn't that long ago, and so we can remember what it felt like. But something I will speak to is the lasting impacts on the public health community that COVID-19 had. Usually when people think about the organizations that were most attacked and hated during the COVID-19 pandemic, they think of big federal organizations such as the CDC. But the majority of people who were impacted by this vitriolic hatred for public health professionals were people working at the local and state levels. Local health departments were on the front lines, helping control the spread, administer vaccines, and triage the casualties. At the beginning, they were lauded along with other health workers as heroes, but as a backlash to the COVID-19 restrictions became more palpable, they became major targets. People working in public health received bomb threats, death threats, direct protests at their offices. It is no exaggeration that during and even after the COVID-19 pandemic, a lot of local health officials feared for their lives and their safety. It didn't help that there were organized targeted campaigns from people mainly on the right-leaning side of the political spectrum, degrading the public health professionals that were working to keep people alive. These campaigns against public health were not only effective in riling up the general public, but also worked in the political realm as well, with varying forms of government threatening to defund public health departments and lay off workers during a pandemic. Go figure. Although the height of these protests and anger geared towards public health professionals because of COVID was a few years ago, the ramifications of this time are still deeply felt today. Since that major anti-public health movement, people have felt emboldened to protest and revile the public health departments. To this day, public health professionals still have to deal with the death threats and political affronts to their job security. The hate for public health seems to have spread out from COVID and now encompasses every segment of public health. Unfortunately, the movement against public health and anti-evidence-based science is only going to get worse under the new administration. Although the new administration has not taken office yet, there are already some, let's just say, controversial and rather concerning picks for the nation's top public health officials. And that is really putting it mildly. Notably, Donald Trump has tapped anti-vaxxer, baby bear killer, and brainworm-having RFK Jr. for HHS secretary. Although RFK Jr. has vowed to make America healthy again, his proposed policies are in direct opposition to that aim. To this point, RFK Jr. has promised a decrease in mandatory childhood vaccinations, removal of fluoride in the drinking water, and a potential decrease in the workforce among federal health agencies like the HHS, NIH, CDC, and FDA. These political crusades could undo countless centuries of work that has led to a decrease of infectious and chronic disease within the American population. That being said, he's been pretty vague about how he actually plans to accomplish these goals and has not actually laid out his plans for how to improve the health of Americans. Therefore, it is actually really hard to pin down what he's actually going to do if confirmed. This ambiguity about aspects of his plan to reform American health are actually more concerning than his already stated plans because, like most of the Trump administration, he's just kind of a wild card. Looking at his rhetoric, RFK Jr. has some really conspiratorial ideas about health and public health in America, and it's uncertain if he plans to actually act upon these conspiratorial ideas when he is acting secretary. For instance, campaigns, he has often mentioned his disdain for antidepressants and anti-anxiety medication, believing that they are an insidious product of big pharma and that they actually contribute to long-term mental problems and other societal problems. In response to this, he has floated plans to either prevent people from accessing these life-saving medications or rounding them up into these wellness camps, which sound just as nefarious as you think they do. Either way, it seems like there will be a lot of what-ifs with his potential confirmation and uncertainty in how he will execute his power. And just to know, RFK Jr. is just one cog in the machine of the Trump administration. There are actually several potential Trump administration appointees and confirmations that may lay siege to the public health infrastructure of this nation, but we just don't know. So with all of that being said, is there anything that can be done? Well, I think most people are using the time pre-inauguration to figure this out. As mentioned, it is really anybody's guess what will actually happen once the Trump administration is in charge, but I think that the general consensus is to prepare for the worst just in case. As of now, people within the field are working overtime to proactively protect the public health infrastructure and ensure that programs and policies are not immediately impacted by the transition of power. However, a lot of people, especially at the federal level, are also attempting to protect themselves. With the threat of layoffs and the reduction of agencies looming over their heads, people are trying to just figure out what this will mean for their personal lives as well as their professional careers. And in terms of what people can do at an individual level, the options are a bit limited as of now. A lot of rights to making personal health decisions and accessing public health resources may be removed under this administration. Programs people rely on for life-saving services may be gutted, which is an extremely scary prospect. In times of great struggle, I think that a good suggestion is to turn towards community. Community building is a huge part of uplifting and keeping each other safe and healthy. Having community is a protective factor and can help ease tension and increase support during these times. Additionally, understanding what resources are available through your local community nonprofits and community-based organizations is extremely important, and if possible, giving to these community health organizations is integral to their success as well. However, I just want to acknowledge that for some people, community building is not possible, either that they can't or are not able to start building communities, so this suggestion is not foolproof. Additionally, education not only about the community resources available, but national resources will be extremely important during this time. Finding trusted sources of information to find public health news will be important and integral to the transition in the Trump administration. And finally, for those who are able, advocacy. Writing representatives and expressing your concern over policies, protesting, making your voice heard, writing to your legislative officials, and donations to those organizations committing to grassroots public health movements is an option and a form of advocacy for those who are able. And let me just say, I know that those recommendations are incredibly flimsy, but I think that everybody is scrambling right now to just figure out what to do, and a lot of it is just being protective to themselves, so it's really difficult to even wrap our heads around what is going to happen. So giving suggestions and examples of things that we could actually do that are tangible and real is extremely difficult. So I just want to acknowledge that those suggestions are just flimsy, and there is nothing that I can do to make them more substantial as of right now. But what is all of this? What is the point of talking about all of this? I hope that I gave a good overview about what public health is, which is really important for those who may not be within the field. And for those who are in the field, I hope that I gave at least some kind of credence to what you may be feeling and some support, because I think that everybody within the field is feeling a little bit stressed out and just kind of uncertain about what the future holds for everyone. So I think that it's important to understand the perspective that the anti-intellectualism and anti-science is not a new phenomenon, that this has happened for so many years, that there has always been backlash, although it feels more pressing right now because of the global pandemic. One of the examples that I didn't mention is like during the 1970s and 1918s with the Spanish flu, which is kind of scrubbed from the record because nobody wanted to remember it, that there was also this kind of backlash. It really breeds this like intense rejection of authoritative powers, and to some extent I understand that. Something I don't understand is this continued kind of going after every type of public health official. Like, there are public health officials who don't have anything to do with COVID-19 who are receiving bomb threats. So in that way, it is different than what people have seen before. And I think that that's just because we have more access to other people's information, and people feel very emboldened by the current political climate. And so I think that if we're all in acknowledgement of what's happening, that knowledge is power, but also that we are all in it together, that we will move through this time, this difficult time together. And hopefully as a profession, we can figure out ways to uphold our values and ensure equity and resources are available to people who need them, and continue to do the good work that we always do. It might just look different, and it might just be that pushing the boundaries of what is acceptable may just be the way forward. But that is all I have for you. I hope you enjoyed, and I hope to see you in the next one. Bye.